Thanks a lot. Appreciate
Not a
that.
problem. So one
Molly, there
I'm
you are.
Molly.
Okay, so
And it's still showing that it's trying to stream.
Okay.
And
Hi, Jessica, too.
yep.
we're good.
All right, did everybody get the agenda?
Yes.
Good. Okay, so we have a number of topics on the agenda. I wondered if people would mind if I sort of maybe went in a slightly different order, or do I have to go in the order of the agenda?
Doesn't matter to me.
Okay, so maybe we start with some of the items that we can get over with quickly, and then the more items that we want to discuss, I'll leave till the next, till later in the meeting. So meeting dates for July to December. I was wondering maybe if it wouldn't be a good idea if we just had Brandy, with the next agenda set out the meeting dates from now till the end of the year. And does anybody have an issue with us meeting every month? I know what usually happens, we usually have a break in the summertime. So, but we've sort of missed so many meetings. I wonder what your thoughts are. Do we meet continuously from July till the end of till December, or do we take a break somewhere?
I'm just gonna pull up and see what we have set for the remainder of the year.
Yeah.
It's my understanding that if there is a break, but yet you feel the need for a meeting, we can definitely get that going. So I see July and August, there have been no meetings set, but by all means, if you feel the need to have a meeting, then as long as everybody's good with it, then I can definitely get that going.
Yeah, I think that will determine the topics that we're going to schedule.
Absolutely.
Year. So
at this point here, I have September 27th as being the next meeting after today.
Okay, and then generally, I think if we look back November and December, we sort of combined the two, right? Because we're close to Christmas, or do we have the December meeting earlier in the month so we don't hit Christmas?
I have it as the 27th, so definitely if you wanted to shoot me an email with, basically if you wanted to combine the November, December, or you were hoping to have it on a different date, I can definitely run that by the powers that be, and if the committee's all good with that, then if everybody's good with it, then I'm sure we can do something, figure something out.
So can I get the committee's opinion on whether we meet July and August, or our next meeting is September?
Will it be Zoom meetings or in person?
It'll be, I would presume, Zoom meetings. And
until
at this point here, it's my understanding that there will not be, I guess, any in person if it's going to happen until at least September. That's my understanding of what I've heard kind of going around the office. And it's not been brought to my attention as to whether or not they're actually going to be doing full in person, or if there's going to be partial in person, or if it's just going to continuously be Zoom. So I'm not 100% sure on that.
so what's everybody's?
Okay, I know myself, I wouldn't be able to make the July meeting, but I could do August. And then if we're looking way forward to December, I definitely can't make the 27th, but if it could be shifted, I would be able to make it.
Okay.
Agreed.
Okay.
I'm aligned to Heather.
Okay. So then I guess what it sounds like to me is that we'll forego July and then schedule a meeting in August. And then so my question is, do you want to combine the November, December meeting, or do you want an earlier meeting in December?
If people are able, I still think we should have a December meeting, but maybe the second Monday or the first.
Okay,
I will
Everybody-
definitely check the schedule and make sure that doesn't conflict with any other meetings,
okay,
stuff like that, and I will get back to you. So that was roughly about the second week you're thinking?
yes.
Okay.
Okay, so I think we know that we're going to meet from August to December, with December being an earlier meeting. And if everybody is okay with that, that's what we'll move forward with. Any objection? No? Okay. Topics for future discussion. I have, Anne Marie had sent me some suggestions for future discussions, and I sort of sit down and plotted out some ideas as well for individuals to come and present at our future meetings. So I can go over them with you now, or I can send out a list with a suggested month that we can have the meetings, and then or have a presenter, and then have the committee confirm, have everybody confirm, because we don't have everybody here right now. So some of the ideas that Anne Maria had provided was having a COVID-19 recovery for seniors to discuss that. So we put it on today's agenda. Safety and prevention for seniors, demographics for seniors. I know some of these that we have had previously, but the issue is things have changed with COVID, and we haven't really been updated on the changes in some of these areas as they affect seniors. And with COVID, they may have an impact in going forward with how seniors are going to be dealt with in the future, with some of seniors abuse and other issues related to seniors. And I know when I looked at the demographics on Canada Stats, unfortunately, the demographics go back to 2016. They haven't updated earlier statistics, but if you recall, earlier in the year, the government sent out the census for this year. So I would suspect that by the fall, we'll probably have some updated census. Anne Marie, you had your hand up.
Yes, if I can add to that. So in addition to what you might want to data mine, and that might be a whole different task, the Barrie Public Library has purchased Enviro Analytics, and they've got up-to-date data specific to City of Barrie on all demographics, and had a recent presentation by them. So they might be a key stakeholder if invited to this table to present on what they're seeing, with a finer view on perhaps just seniors or individuals over a particular age. If you want a look, I believe it might even be 2019, 2020 data. But they've got a really rich data set there that can give us an up-to-date picture about number of seniors by ward and other demographic information.
So what's the program called again?
It's not a program, it's the Barrie Public Library. So this is just data that they have accessible to themselves. Yeah.
But who provides the data?
It's a third-party contracted agency that does data, Enviro Analytics.
Analysis.
I'm not sure if I got that right, but they do a lot of that as a purchase service.
Okay, so the library's purchasing the service, or the city?
The library.
Okay. And
it would be the library presenting on the data.
right, and so then that data should match the data with. So when the data, is it Barrie and area, or just Barrie?
Barrie.
Barrie, okay, and it would match Stats Canada's information.
It might be a bit deeper dive, so that might be something that you might want to ask them.
Yeah.
And if you decide to do an invitation for a presentation, they could probably give you a bit of insight. So for instance, I'm looking at data that talks a bit about high level, where individuals by age, by ward, where they potentially spend their money. Do they choose to volunteer? How are they living and interacting in Barrie? In addition to language spoken and other demographics. So very, very rich picture of individuals that I think would be beneficial to be aware of, and is probably the most up-to-date, succinct information at hand that's ready to go.
Okay, perfect, great, okay.
Donna, I
so-
just wanted to let you know, we do have Paulette. She's been bouncing in and out. She's been trying the link. The link does not seem to be working for her to be able to attend the meeting. So unfortunately, she is on the phone, and she indicated that she's unable to basically speak with you folks if called upon or if needed. But I wanted to let you know she is in on the meeting at this point here. It's just unfortunately by phone. Okay.
Okay,
Thank you.
so do you want me to send out topics, or do you just want me to go over some of the topics now so you know what I might be recommending? It won't take long to go over some of them if you want.
Sure.
Okay, so again, senior safety and seniors abuse. And I know in the past we've had police services and also EMS in. So I was thinking of police services. I'd like to see some discussion around ageism and the effects on seniors, age discrimination in Barrie. And I was wondering if the police services would be able to provide that. Also, I thought it would be good to have some update on mental health needs for seniors and ongoing communication needs. Mental health, especially with COVID, how the lockdown has affected seniors' mental health. So I was thinking we could have mental health come and speak to us about that. And maybe at the same time, talk about updates on 211 and the number of calls from seniors to 211 during the COVID period, and just in general, if those calls have increased and what kind of calls for services they're looking for. I did have the library down, and I also had the county of Simcoe, because I know the Simcoe has updated their plan and some of it affects Barrie, but not all of it. So the things specifically affecting Barrie seniors. And I know that in the past we have requested that the city look into some kind of a subsidy for adult home adoption, but unfortunately I don't believe anything's been done on that end of things. So I would probably want to ask Simcoe County how their home adoption program has gone, even though it's not something that Barrie residents can apply for. I wanted to have updates on our mandate and focus. And when I get to communicating seniors advisory committee at the end, I can talk a little bit about that. And then in January, I was thinking of having the media expert that I talked to come and discuss a plan for promoting the seniors committee. And then also to talk about Seniors Month, but that would be January 2022. I would want to do an update to the mandate and focus sometime either September or October, because we need to, according to the media department with Barrie, that needs to be updated in order to be able to come up with a communication plan that would be effective for our group. Now, I guess my question, Brandy, you can help me out with this one, is to make a change to mandate or focus, that has to go to the city for approval, right? Because it would be an effect to our terms of reference.
Right. So as another committee had done, is they had created a motion to be heard before council with respect to basically amending their mandate and their terms of reference for committee reasons. So yeah.
Yeah, so then we would have to make sure that we do that probably around September, so that we have enough time in the year to have that approved by council in preparation for our January meeting. So those are just some of the areas that I had thought about for future meetings. Is anybody any concerns about any of them, or any other areas of interest that you would want brought to a meeting? Jessica?
For this senior safety, I think that we had discussed the Prevention of Seniors Abuse Network of Simcoe County, that they would be ideal to bring in to discuss. They've recently just had a seniors community grant, as well as a New Horizons grant. The committee is working full steam ahead. So I think that that would be ideal. Barrie Police does sit on the committee as well. So they do work in tandem and hand to hand, as well as when you're inviting the 211. They recently have a grant as well as working on a project for reducing seniors, reducing isolation within the seniors or seniors isolation. I do sit on that committee. They're in the process of putting out a survey right now to get feedback from the community. It is Simcoe County wide. I think that you have some amazing lineup. I just wonder if it's too many. We don't have enough meeting. It sounds like a lot for about 5 meeting dates.
Right. So what I would do is I would make a list, okay, and send it out to the committee, and then ask you to prioritize what you
good.
feel would be important. Anything that we can't include in this year's meetings, we would defer to next year. And so, that would help us to line up some things for February, March meetings and have that in preparation for next year.
I think that would be perfect, because my next line was that I think that we need to ensure that we have the feedback from the committee, just to make sure that we're on the path that is encompassing everybody's sort of work.
Yeah, and the other thing is we have to find out from individuals if they can come, because that may be another issue as well. But being able to establish an agenda in advance, we can do that, finding out if those individuals can attend, and if they can't, then we would rearrange our schedule to suit the people that can come to our meeting and speak. Gwen?
We can suggest other things, right?
Yes.
Like I'd have to do my homework, but I'm thinking technology for seniors. I think there are many new things out there on the market most people are not aware of.
Yep. Yeah, there's been quite a bit of discussion about that, especially in regards to Alzheimer's and dementia and memory loss, because they are talking about how some of these devices can help individuals who are developing memory loss, and also with vision. So we have to find out what agencies or organizations would have the best information.
I think Sunnybrook just did a test using radiation on people with Alzheimer's. It was just a very small test, but it seems to have worked, and they're hoping to get the funding to do a larger test, which is good news.
I know that Baycrest Center for Geriatrics does a lot in regards to seniors research in that area. Anne-Marie?
So I'll put on my board chair of the Alzheimer's Society Simcoe County hat and just mention that the AGM just occurred, and we brought in a researcher and knowledge exchange expert that shared, I believe it was recorded. So that might be of interest to the committee if you'd like to see presentation that was made I think less than 2 weeks ago. And it talked a bit about some of the treatments, and even a new one over the past 2 weeks that broke in the market that's promising, but where research is going around Alzheimer's and dementia. And that's free and available. And I know Lucia has her hand up. I'm not sure if you've seen that, Donna.
No, I can't see her at all.
Oh, okay, sorry, I'm here, thank you. My first thought was covered by Jessica. So yes, the PSAN committee, I'm on that as well. Unfortunately, have not been able to attend due to a calendar conflict. But the other piece too is June being Seniors Month, we had a meeting where we invited Minister of Seniors, Minister Cho, and he did speak to a number of programs that were put in place for seniors, a new $10,000 home renovation, which covers 25%. So I don't know if there are some additional things that have come through for seniors out of COVID that, even though they're not local, and I know we don't qualify for Simcoe County initiatives, but maybe there's something else that we do qualify for. Just be curious about what's out there like that.
Okay. So we can put that on the list of updated programs for seniors in Ontario and see what feedback we get.
Yes, in
And
terms of
I'll add
like,
that to the list.
great, like home
Um,
modifications, anything to
Please
support.
excuse me, it's Paulette. For some reason, they just now let me in, so I'm vocal finally, instead of just hearing. Sorry for interrupting, but I just wanted to let you know that that happened just now.
Yes,
Okay,
so
that's
Paulette.
home,
Yeah,
you're
and-
talking about home renovation. Is that the one through Simcoe County?
no, I was mentioning the federal initiatives that have
You're
come out.
talking about the disability, the one for assistive devices, right? You get 2,500 out of a 10,000 grant.
My understanding was that it was just new and it was around home renovation,
Yeah,
but I haven't dug into it much deeper. But just truly, all I keep hearing is about, we want to age in place, but we're just really not getting that help to do that.
no, you're
And
right.
so that's where I'd really love to see us do a little more research. You know, people, all I keep hearing is no one's being qualified for getting PSWs. They can't afford the private companies. And really, sometimes it's just a matter of having someone come in a couple of hours a day, and people aren't even getting that. So I'm just sort of worried that we're talking about aging in place, but there's really nothing there to support that.
Right. And I think it might be good for us to look at all of the initiatives that are being put in by the provincial government. But the question is when do those initiatives come into play? When?
I think most of you have probably heard of the butterfly effect for long-term care homes. They were supposed to build one just outside of Barrie, and it didn't get approved. And I'd like to see if we could find out why, because it's transformative care. And if I ever had to go into a long-term care home, I want to go into one of those. So I'm wondering if we can find out who we would approach to find out why it wasn't approved. And I think it might have had something to do with the city of Barrie, because it was on the property they had was right on the borderline of the township and Barrie out on Bayfield.
Would the company not be able to tell us that?
My contact there has taken a different job. She's moved up the ladder. So I don't know who we ask anymore.
Well, Lucia, when you had the Minister of Seniors come, did they answer questions and take back questions to get back to you on? So if we were to say, look at having the Minister of Seniors come and talk to our committee, would they respond to you if you asked a question, that type of a question, do you think?
Well, I suppose they would answer questions. We didn't ask them to come back to us with anything. It was more of well, it was in honor of Seniors Month. So he did mention these things, but we didn't say, you know, we didn't ask for anything more from that because we had additional agenda items, but surely he would be able to do that.
Okay, I think maybe I'll put that on our list, because that might be a way we can probably look at additional programs, and Gwen's question about how they determine where a seniors home goes. And it might be an idea too that we give the minister some idea of questions we would like have answered, so that when they come, they are also prepared. Because in some cases they may have to go back and ask these questions. And Brandy, I have a question. If we wanted to send any kind of a letter to the Minister of Seniors and ask questions, are we allowed to do that as a committee?
You know what? Leave that with me. I'm just going to get you, I don't want to
I know it's
give you wrong information,
yeah.
but so what I will do is I will definitely go jump on that question with management, and I will get back to you. So carry on.
Because you know, to have someone come and speak, they can talk about the services, but if we want to ask questions, they won't always necessarily have the answer. But if we could send them a letter in advance of a meeting, they might be able to bring answers back to us, you know, that would be helpful for the committee. So I'll
Okay.
leave that with you then. You can find that out, but I'll put that
Absolutely.
item on the agenda. Okay, does anybody else have anything they want me to put on this list that I send out? For future meeting? No? Okay. All right. Well, if you do think of anything when the list comes out to you, then please, by all means, add it on. And when you're done, if anything new has been added on, I'll make sure it gets circulated so that everybody can have an opinion on it.
Thank you.
Jessica, can I just ask you the name of, I didn't write, I was writing while you were talking, the name of the committee that you were suggesting might be able to provide some answers for us? On
The Prevention of Seniors Abuse Network.
Okay.
And
Okay,
if you need a contact for that, just let me know.
I probably will, but I want to put it down as an item so I make sure I get the title right. Okay, great. Okay, so now I'll send that out, and then by August, we should be able to, whatever the priority is, we'll try to get that booked for an August meeting, the first priority on the list. So Gwen, just take you next, but if I send the list out, I'll put a date on it. And if I could just request that everybody get back to me by a certain date so that if we do want to schedule something for August, we can get it in the works and make sure that we get it to the individual or the group that we want to come and book for that month. Okay, Gwen, go ahead.
I just wanted to mention that the home share program between Georgian College and the city of Barrie, well, with COVID, it kind of went defunct, but I spoke to Martin Rochon last week, and there is a meeting this week. I think he said on Wednesday, to try and see if they can revive it for the coming year. And I thought we should know about that.
Yeah, I actually put that down also, Georgian College programs, because they had a new program this summer with trying to match students for more like work programs, voluntary work programs. And they had quite a good program actually, and I'd like to know how they made out with it. I think we probably would like an update on, like you said, the home sharing, but they've had a couple of programs trying to match their students with people in the community to do volunteer helping sort of thing. So I think they would be another good one to have back. Anne-Marie?
The other one we talked about in the past as a topic was affordable housing and an update about where that task group was going. So I can share that maybe in the meantime, a summary report on all 3 task groups about the theater, the precinct, and affordable housing have been published. And I'm not sure if Brandy, that would be something the committee would be interested in having circulated by email. But we had talked about whether or not Mayor Lehman, as chair of the affordable housing task group, would have ability to share some of the pieces this committee was interested on around where we're going with that. And I believe that committee will be done at the end of this calendar year with some recommendations forward. So it might be something in the fall of interest, or for now, it's a really great summary report on the dialogue and scope of what we've been talking about and considerations to date around affordable housing.
So by any means, anything that you want circulated around, forward that to me. And if it's a question of whether or not it is allowed to be circulated or should be circulated, I could definitely find out, answer it. And
So
send it
Brandy, yeah, thanks Brandy. To clarify, it's in the circulation list. It's public facing. It's
there you go.
brought up, yeah, I think it might just be making sure we can easily retrieve that and share it with the group if that's of interest around the summary of the affordable housing. Yeah.
When? I'm sorry, when is it available?
It is now. It's public facing, but it's on the circulation list from last meeting, Brandy. Because those don't come weekly, you can get more than one, I think. So it's sitting there. If it could be maybe pulled from the circulation list around the affordable housing task group update. It's about a 3 to 5 page memo on the 2 meetings that we've had and the areas of focus and priority focus for that group moving forward. And then it might be nice context setting for any update around what happens this fall with final recommendations of that group. But it was a nice summary. And then lastly, Gwen, just coming back to the Butterfly Project, if that is a topic that comes forward, the only thing that I could find to my recall was in 2019, IOF Seniors Home had been in the media around that. So there's a nice YouTube video about that approach. And I think around at least what's happening there, but maybe the administrator could give some information about if there's anything else happening or the learnings there, or if there's some momentum, I'm not sure. But that's the only thing I could find around the Butterfly project implementation.
Thank you.
You're welcome.
I had emailed and oh, my head here. Anyway, I talked to one of our committee members in regards to seniors housing. And one of the questions I had is when an affordable project goes forward, it was Cheryl Dillon, how many of the units are actually affordable housing units? So if you have a building with 60 units in them going up as considered as an affordable housing unit, what percentage of them have to be affordable housing? And I know I've seen this happen on projects where people think the whole building is affordable and only 10 or 20% of the building. So you might only have, 6 or 12 units out of 60 that are actually affordable housing. And then in Barrie, there's an issue because of Simcoe County has some impact on affordable housing in Barrie, because then the cost or also the subsidies for people living in affordable housing units all affect how many units actually get put into place. So the task force that you were on, Anne Marie, did they look at those issues or discuss those issues in their reports?
I think it would be great to start with a summary of that, because we've had 2 meetings and it's pretty high level, but we
Yeah.
also had, which has been great conversation. This is happening everywhere. So I'd almost say, we need to break down how we use even affordable housing, because it means different things depending on income. And in general, when we talk a bit about, I would just say mixed use and or a range of income, even if you build it and you perhaps call it affordable housing or meet an affordable housing metric, depending on if it would be something that would be sold versus managed as a rental where you could have more control, it doesn't mean it's going to be maintained at an affordable housing. And then we often see this conversation about, well, it's more affordable than current market rate. So I think there's good dialogue happening too. And if this committee hasn't seen it, at the previous planning committee meeting, we had staff from our planning department present on public consultation that has happened. It's been recorded. It is really good discussion about how we're looking at making changes to our zoning bylaw to support affordable housing. There is a really great link public facing on the City of Barrie website that talks a bit about key areas where staff have come forward to propose changes. One is how we look at, I think, industrial land and making industrial residential, how we rethink some of the areas where we could have properties around infill building, but also even around changing some standards when we talk a bit about secondary suites and those accessory suites. And if we can modify, so one position was if we modify removing some of the limits on size, it could incentivize some smaller builds, and the thinking of if we support being able to build smaller, we might be able to see that it justifies a lower rental amount. So there's broad conversation happening, but I would say those 3 pieces would be quite topical and probably bring the committee up to speed around what's in scope of the task force, what's moving ahead around zoning conversation to support affordable housing. And that comes with a change to our zoning bylaw, and then our official plan is in draft 2. So there's some good changes in there that should drive policy.
Right. And I think it would be, I think we really need to understand that affordable housing has many components, and those components vary in how you define what's affordable. And also subsidies for affordable housing come out of Social Services Administration budgets for the county, I believe, in some cases. So if there isn't tax dollars there isn't subsidies. But the other thing is, did the committee look at in Toronto has that project that they have with the federal government to build they built 100 units in 3 months. They did those stacking units. They have a grant with the federal government that builds affordable housings in short term. Did the committee at all look at that program?
So I'm not prepared to cut a quote if that was a specific one. We do talk about a range of different models and opportunities, but we really do bring it down to where can we make some strategic areas of progress around affordable housing. And so I would encourage you to read that short report to give you a sense of the scope of the conversation and where we're going, but also I would encourage the group to watch the recorded YouTube on the City of Barrie site. If Brandy can send that forward to the group, that's staff presenting on changes to the zoning bylaw. And then the dialogue after with the public, I think, was quite interesting around the range of different views. But I believe it was Shelby White did a really great job talking a bit about proposed changes and rationale for that. This committee might have a position on some of the things you'd like to see changed in that zoning bylaw. So that might be a topic of conversation around if you would have a recommendation or if you would have an endorsement of a change that's being proposed. And that YouTube video gives a really nice succinct summary. And the website under our planning and development page, Brandy, that's also something you could send with it, also gives a nice summary of the main changes that are being proposed. So that went to public consultation, that feedback's being looked at. And then I think it's coming back in September. So it might be an agenda item for our August meeting if this committee is interested in the meantime, taking a look at those two documents.
Okay.
Very.
What's the outside date for making any kind of proposal to it? What like if you're saying if we have any recommendation or endorsement, what's the outside date for the committee to look at that?
Well, they went through public consultation, so if you can come back to me, I'll just look it up online while we're talking, Donna.
All right, great. Okay, thank you.
You're welcome.
Okay, so that sounds like we might have an August item or a priority. Okay, so we're off of future discussion. We'll come back up to COVID recovery for seniors. I was thinking that we could have a discussion now to see how everybody on the committee has managed, or we could look at that as an item for sometime in maybe November or October, because COVID is just in the process of, we're just coming out of COVID. So to talk about COVID, it might be good to wait until we've come out of it to have a discussion. But if there are any issues that anybody wants to bring up now in regards to how they managed through COVID, or seniors that they've talked to in regards to what they've learned, or anything specific that might be of help for us to make any kind of recommendation to Barrie in regards to when we get into a pandemic where seniors are concerned. Anybody got comments on that?
I think there's could be some validity in the organizations that sit on the committee sort of providing an overview of what services that they're offering, what have they been offering, what does it look like moving forward for them. You know, I think that getting feedback from older adults now as we are in the middle of the pandemic or coming to the end is also a valid point, instead of waiting to the end because it's fresh in their mind. They know exactly, you know, how well they were able to cope or not cope, or what they needed or didn't need. But I think that it's also hearing from the different organizations throughout the community, as well as who sit on the committee, as to how they have pivoted during COVID and the services that they have offered.
So
Could we-
Heather, would you have any comment from a Red Cross point of view?
Well, I'm just thinking, kind of, I can obviously talk about what we have done and what we've pivoted to, but for post-COVID, we can't really know until we're out. Like, we can only plan with what's going on with the restrictions that are in place. And because we never really know what's coming until it's coming. It's hard to plan kind of post-pandemic how things are going to look for us. So that would kind of be my only caution, is if you're looking to the future, we may have to wait until we sort of have a better idea of what that looks like.
So what did it look like for you during the pandemic?
A lot of restrictions on our services, particularly transportation. We are no longer using volunteers driving in their own vehicles because we can't watch the sanitation. We can't expect the volunteers to set up barriers in their vehicles between themselves and the clients. So we're definitely restricted capacity. Our vans, which are outfitted with barriers and can be sanitized regularly and well, we are running those, but even those are at reduced capacity because we have to build in cleaning time, and we can only take one client at a time instead of packing them in like we used to do. So we've seen a lot of restrictions for a lot of things. We've done a lot of pivoting as far as moving our programs virtual where we can. My friendly visiting program is now strictly over the telephone. We're not doing any meet and greet visits in person, and I don't know when or if that will change. I'd like to see it change, but I don't know. Meals on Wheels is about the only thing that's run continuously without any change throughout the pandemic. All we've done is move to more of a contactless delivery wherever we can. But the program
How do you
has
think
run
that's
without
affected?
interruption.
How do you think that's affected your clients? Have you been able to provide some level of service that's acceptable, or has there been a lot of concerns about the level of service?
With Meals on Wheels, like I said, nothing's changed. We've increased services even, so that's been great. The friendly visiting, some people have been great with the telephone and really enjoyed that. And others have told us that they do miss the in-person, and that's both our volunteers and our clients. So, that's definitely something that has affected people. Transportation, that's been different. Like I said, we're reduced capacity, but at the same time, people aren't going places that they were before. So we haven't had quite the same demand that we normally would. So it's hard to say.
Okay. As an organization, do you plan to do a post-COVID sort of report review of what happened?
I wouldn't know.
Okay. All right. Lucia, do you have any comments?
Oh, yes, I have a question for Heather. Heather, so many of our CNIB clients really count on Red Cross, and there's a lot of speculation that goes around during these times. And someone mentioned that they had heard, and I don't know if this is correct or not, that going forward, Red Cross would no longer be offering rides to non-medical activities, that it would be changing its model of what.
No, that would strictly just be speculation. No, there's
Okay,
nothing in
great.
place. In fact, as we move through the stages of reopening, we're, based on capacity, able to open up the kind of transportation that we do. But yeah, it's based on capacity really more than anything. And we certainly have every intention of opening things back up too.
Great. Well, I'd love to
where we
continue
can.
offering that hope to everyone, because that's what they really, really depend on. Thank you, Heather.
You're welcome.
Lucia, how have you found your client? How have you found your clients managing during COVID?
Well, there are a couple of different perspectives, I guess. Well, maybe much more than that, but often our clients have been accustomed to being isolated. So a lot of them just say it's not too different, but others have said, that they felt more isolated. We kicked in with all virtual programs, and we really covered a lot of people with that connection. So that's been really positive. In terms of getting back to things the way they used to be, everyone's anxious for that. And we'll still continue on with virtual programs, but also obviously we look forward to bringing everyone back together. So in terms of that isolation and access to services, there were a number of different things that came up. And one big thing that's happening is accessible point of purchase, those terminals, the where you pay with your credit card. There's an accessible machine that's coming out, which is exciting. So there have been a number of things that were brought to light during COVID. For example, people not having access in the same way. But at the same time, there were so many great services that kicked in, like VON went straight to offering home delivery. We also provided that through volunteers, but grocery delivery was covered. That was important. Access to vaccination, transportation, that's been really great as well. So I think overall, there were so many services that kicked in that for the most part our clients were well taken care of. Now say that, but there may be pockets in rural areas that were kind of left out, but I'm hoping that, as is often the community approach in areas like that, people do rally around each other. But overall, I thought things had been well managed.
Great. Does anybody else have any experience or anything they want to comment on about the last year and a half with COVID?
I think it would also be great to hear from the Gilbert Center on their 55 Plus initiative. They
Yeah.
received significant funding from the Seniors Community Community Grant to broaden throughout Simcoe County as well as within Barrie. And I know they've had some great initiatives off the ground, but it'd be also great to hear from them about what it is and maybe how we as the committee can support them as well.
Okay. Well, I'd still like to put another COVID update later in the year, so I think I will continue to put that on our agenda. I know I finally broke down, got some services for my mom because she's really declining. But one of the things I realized, especially with home service, home and community care, it's because they contract out their services with agencies. They're not allowed to go to other agencies when they run short on staffing. So then the PSWs have been hit and miss because of lack of numbers. They don't have enough PSWs, or the demand for services increased. But part of that is that they can't go to another agency because they're contracted with one agency, which I think is disappointing because there are other agencies that might have had staff. They can't share staff, which is disappointing. But I know that one of the PSWs we had mentioned about a new program that had been put in place to fast track PSWs to be able to use them in services. So I think there are some programs that have developed to get PSWs into the field. How much training they get will become an issue because if they're getting limited training, like the PSW course right now is only 9 months, which is not a very long program. And in the fast track, I think it's even shorter than that. So I think that also has an effect on the type of service that's provided to individuals and the knowledge of the individual doing the service. So I think it's brought out a lot of those issues, but to change a contracted service is not something that we can change. It's something the government has to initiate a review of and determine. I don't know how many of you were in the healthcare system back in the 90s or late 80s, but at one point back, I know in rural areas, PSW services and home care was provided through the hospital. And so the hospital would have their own staff, and then they would have the staff. When they ran short, they could utilize hospital staff as well, PSWs, in order to provide services in the community to subsidize lack of individuals. And I think having many small agencies creates problems in being able to give good service delivery. And I don't know how, I'm putting it to thought, how that can be addressed other than writing a letter to your MPP in regards to it. So I know that a lot of people have concerns about support, especially home support. And I think those are some of the issues that really need to be thought about. And I don't know whether Heather or Lucia have comments in that regard, but I think it's something. Oh,
My dog.
your dog has comments. That's kind of cute. Yeah, no, I think there are roadblocks in the system, and how you overcome those is a good question, because the limitations sometimes are the systems, not necessarily the fact that there are people out there to work in the system. So anyway, that's my comment on the COVID. Anybody else have a comment in regards to Anne-Marie?
Just a quick one, because it might take us away from what we might be able to influence. But on your note, Donna, around that, I'm sure most of you are aware there was a cabinet shuffle recently. And
Yeah.
so you will see a new individual, Marilee Fullerton, now in the home and community sector. So it might be interesting to watch and see if there's anything in particular, but with that change, whether or not there'll be any type of announcement around that portfolio focus. But, you know, there's some reports out there that we've done at a local level in the healthcare system about PSW. And that might still be public facing, I believe so, but it was through the CCAC at the time, a couple of years ago. And that was a research report that talked a bit about the trends that we were seeing around the decline of PSWs into selecting that as a career opportunity, and basically forecasting the crisis around demand. So it's an advocacy issue, I think, on several levels, but might not be one that we can target, but definitely one that impacts us all. But I'm not sure where to direct you other than, you know, local Ontario Health around the North Simcoe Muskoka region, and asking about where seniors and aging fits, and because they still cover this area, and I'm not aware of what's being done on the home care sector from a impact analysis and demand versus meeting demand.
Gwen, you have your hand up?
I did. Regarding Minister Fullerton, CARP advocated to have her removed from the long-term care because we felt she was totally inadequate for the job. She's probably a lovely lady, but I don't know if we should get her hopes up. Just
Yeah, I won't make any
I hate to
comment
say it.
on that. There is,
Yeah.
there is
Well,
lots going on out there that,
Yeah,
probably is to everyone's awareness.
I get the, I'm still, having worked in the system, Advantage Ontario still, which is the nonprofit association, still sends me all the updates in regards to what's happening in the sector. And I know they're putting a lot of money into the sector over a number of years. I guess it just depends on how much, fruit that money will bear in, training people. But a lot of people that get higher education now don't want to go into lower paying job. Well, how do I say it? It's not really that lower paying, because I just looked at some of the union contracts out there that got settled for long-term care homes. And while those homes are earning a lot of money, like between $21 to $23 an hour on a PSW, and that doesn't include compensation. Some agencies that provide home care in the home sector, their wages aren't as high and they don't have a lot of full-time jobs. But I think there's this, the system is so huge and hard to deal with. It's not an easy one solution fix, unfortunately. But I know a lot of people complain about not having home services, and I know we brought up earlier that one of the things that we want to look at is how do you keep people in their homes? Well, if providing those kind of services to people in their homes is necessary, the problem is the service levels are not there to be able to do it, unfortunately, right now. So I know the dollars are going in there, but I don't know how effective those dollars are going to be. Anne-Marie?
So I'm wondering if we have awareness of if Doug Downing will be having his seniors event virtually or not at all, because typically that would be a great place where everyone from the public and even healthcare would gravitate to hear any announcements, to come together to look at strategies, but also then from a communications often was a great place to either have a booth or get feedback or be able to listen around what's most concerning to individuals that are attending that. And usually there was great turnout for that. So it might be something that can assist us in, how do we still stay in our mandate around what we can influence, but also become aware of maybe what's coming, what's the conversation. While we might also, it could be an opportunity for us either this year or next year, if it's something that is not happening this year, to have a table at to then also identify that for those residents in Barrie that might be attending these events, who's the seniors advisory committee of the city of Barrie, and opportunities to then look at when we open up that process, if they want to start having the conversation with members about the value of joining the committee and considering that after the next election.
Okay, great. Okay. Yeah, it is. I think when we go back to the committee and when we first set up our, our goals and objectives, one of the ones that we had discussed was, keeping people in their homes when they're, when they age. And I think we had a lot of discussion about design and services, and we really didn't. It's something the committee has had concerns about in the past. So when does Doug Downey have these meetings? Do you know?
I don't recall offhand. It was an annual event that happened. I used to attend them from a health perspective. I know Gwen and Carp, I think it would always be active. And so it might be worth reach out if that's possible through staff, just to engage maybe Doug Downey's office to see if there's a plan. Typically there would be a call out for booths or anyone in the health system that wanted to have a booth. And then it was a public, very open public forum that had a lovely day-long agenda.
He was hosting two, one in the spring and one in the fall.
Yeah.
We participated in both of them, and there has been no call since COVID.
Okay. Okay, so maybe that would be something the committee could consider now that we have the materials to put at a booth. That's great.
Yeah, okay. It'd be good to hear what's happening. So maybe if the fall isn't in person, maybe we want to identify our interest to hear about what's happening in the spring.
Okay, perfect. Okay, great. Thank you. Good discussion. Thank you. Okay, so our last item on the list was our communicating the Seniors Advisory Committee. And I had taken the time to meet with someone from the media department with the city, just to get an idea of what we could do as a committee to sort of publicize who we are, to get individuals in the community to communicate with us their concerns or their needs or about seniors. And they had some ideas of different ways that we could bring forward the committee, like through the age-friendly page, Seniors Without Walls, through the PALS Seniors publication, possibly Barrie Advance, Councillor Elwin's online talks, or even through library sessions. But before we could do that, or even have a booth at the Barrie Farmers Market, or work through the churches. But before we could do that, we need to take a look at a few things, and those items would be part of the things that we would look at for future meetings. Updating our mandate, looking at our focus for next year, reviewing our past successes, and determining if there's any area of the age-friendly plan that we need to focus on for input from the community. So there are things that we need to do, and I thought that those items would be one of the things that we would spend time at one of our meetings, and I would think that we should set aside a meeting specifically just to look at our mandate and our focus in the fall before we bring someone in from media to actually set up a plan to put a media plan in place for the committee to get us out there in the public. So if it's okay with everybody, I think the best thing for us to do in that regard is to actually sit down at a meeting. In order to prepare for that meeting, I would need everybody on the committee to go back and review our mandate, review all of the, think about the things that we've done. So what I would do is send out a handout with all of this information for you so that you know what to look at previous to the meeting, and be prepared to come and discuss at the meeting what we do in that regard. So is everybody okay with the fact that we look at doing that, and then as part of our meetings in January, February of next year, look at doing a media plan to promote the committee and bring the seniors in Barrie to our attention so that they know who we are. I know we've had a few seniors come and sit at our meeting, but they have also expressed the fact that they are not sure about what the committee does or why we're here. So I think it would be good next year to really plan to do that if we want to move forward, bringing issues up that support what the community wants in regards to seniors. Comments?
It's always good to have a report card.
Yeah. Okay. All right, so that will be one of our meetings that we'll set aside, and whatever date we have previous to that, I'll send you out some materials that you can look at in preparation for that meeting.
Yeah, Donna, sorry, it's Lucia. If I could just
Yeah.
speak to that question. We have tried to let seniors know what we do, but how do they perceive that? And what is our actual relationship to all the seniors out there? We really don't have any contact with them. We don't really have them out to meetings. You might have the odd person that's interested. So really, what is our relationship to the average senior? If we really want them to connect with us, and if they perhaps want to connect with us, it really is such an ununderstood role that we have. And I have to say, sometimes I'm struggling with what it is, because we can meet and we're advisory, but oftentimes I'm not really sure what we've been advising on. Like, we haven't been asked to advise on anything in particular. So I feel like sometimes we're doing circles. I hope that doesn't make me unpopular to mention this, but it does. You have such wonderful, wonderful ideas, Donna, and I'm so grateful to have you guiding us. But there is a bit of a dynamic here that we're missing out on, that there's maybe an opportunity to cultivate. And maybe that's what you're suggesting we're going to work towards.
Yes.
But really, we have no relationship with seniors in our community. And if that was our original intent, and I think it may have been, I'm not sure, maybe Gwen could speak to that, then we have not met that. Just saying.
No.
Well, sorry.
Go ahead, Gwen.
Our original intent when I went to Mayor Lehman to start the committee was to make us an age-friendly community, and we achieved that in part. It's where we go from here, and I agree, it's very hard to reach many seniors. We found that a problem from the beginning. In fact, many seniors wouldn't be able to join us on a Zoom meeting. And Donna, can I talk about what CARP wants to do? Is that loud?
Well, it wasn't part of our agenda item. We could probably put CARP on one of our agenda items, but if it's specific to CARP, then it doesn't really bearing on the committee. I think what has bearing on the committee is what the committee wants to develop as a plan for promoting different issues or bringing forward different issues in regards to Barrie seniors. So I think we should keep the two separate. If there's something specific to CARP that affects the committee.
It's regard to seniors living below the poverty line. which is 19 to 20% of Ontarians. I don't have a specific for Barrie and area, but I know it's 19 to 20% in Ontario. So
Yeah,
it is.
yeah, no, I understand. Well, the 2016 statistics showed that 13.5% of the low income status in Barrie was individuals 65 and older. So 13% at that time were below, or what they considered low income seniors. So it is an issue, and I think it's an issue that we as a committee have discussed a number of times, because we tied that with elder abuse and shut-ins and people. And I know, Jessica, maybe Jessica, you could speak to it too. Remember, we had talked about how you reach individuals that are sort of below the poverty line. We talked about that about a year ago, because we were thinking that with the Horizon grant, we should look at doing some sort of a survey, an investigation into how many people actually are living below the poverty line with needs that we don't aware of. And I know we had discussions on it, but that could be something that again comes forward on one of our meetings that we're going to have because I think it also ties to abuse to seniors and services that are provided to seniors who are in need. Jessica, did you have any comment on that? I know it's something that you had been concerned about.
No, none at this time. I don't know.
Okay, but that's something we could put on one of our discussions. So you could add that to one of our discussions. And to Lucia's point, I agree, but I think the committee is growing too. Like the first 3 so years of the committee, they spent on the aging plan and the development of that plan that Cheryl was part of. And then when we came on, or when I came on scene, we started to look at housing. So the committee hasn't been in place for a long enough period of time. It's maturing as it goes along, and it's growing in its approach to what it feels the committee should be. So I think we're at the stage now, to Lucia's point, where we really need to put down some foundation for what the committee is going to stand for and how we're going to bring that forward to the seniors, what methods we're going to use, how we're going to let people know who we are, whether we do surveys, whether we get out in the public. I think, Lucia, we're right at that point where you are talking about who are we and what do we stand for. And I think that's great, because that feeds into exactly where we want to go next year. And I think you're right on. And I think, Gwen, you probably have a lot to contribute, knowing that you're the one that wanted this committee in the beginning. So you would bring to the table a lot of good points in that regard. So I think if we can, as a committee, come together, establish whether the mandate we have or not is where we want to go, and then determine how we want to move forward to the public and make recommendations and bring ideas forward. As an advisory committee, we are sort of limited in that we can make recommendations, but we can't make change. We can only make recommendations. And sometimes those recommendations do make change. So an example is when the mayor came forward and wanted to know if we agreed with the Georgian College program, or not. And we made a motion saying that we agreed with the program and that the city should go forward with it. So I think we do have some areas where we can confirm what we think is right for seniors. But then on the other hand, when we made the recommendations about housing, our motions had to be changed in order to meet the city's requirements for its plan on where we could go with housing. And well, we had an idea. It wasn't exactly what the planning department's idea was. So we felt a little discouraged because of that, a lot discouraged because of that. But that being said, I think in the growth of the committee, we're learning how we can do things and where we're best fitted to do those things. So to encourage you, I think we're now at the point to sort of move forward and make some things happen. So I think if we could just get through the rest of this year. Molly?
I think that, I hope you can hear me because I've no mute on.
Yeah.
Can you hear me?
Yes, we can.
Good. I was fortunate enough to be with Gwen when we approached the mayor to see if this committee could take place. That was many years ago.
2013.
The mandate was established then. Barry has changed. The makeup of Barry has changed. Seniors' needs have changed since then. And I think it is vital that we have a different mandate. And I think it would be excellent if we could give some suggestions for what that mandate might be.
Mhm.
We might be turned down, but we've been turned down before. And if you've lived as long as I have, you get used to being turned down. So, I mean, you know, it doesn't stop you.
Right.
But I think where you're going is excellent. And I hope it continues. When is the election due?
Next year.
Yes, because then the committee might change.
That's right. But at least if we set the mandate and we get that established before the next committee comes on, they won't have as hard a time trying to figure out who they are.
No.
Anyway, Anne Marie, you had your hand up.
Maybe just as a point of information, but on the conversation, my thinking goes to where City of Aurelia and their age-friendly community, I believe representatives looked at our plan, and they're in the middle of engaging right now publicly. And I'm looking at their survey, and it's a nice piece, and it might be something we consider when we look at coming back, is also what information and how are we being informed about the current understanding of our age-friendly plan? And is there a quick survey we could do that basically says, what are the gaps or other priorities? So knowing that we've done this and we've come this far around our age-friendly community plan, what's top of mind for you as a senior? And getting some of that input in to then inform where we go or understand what's in and out of scope. Because I think the survey could be one that is kind of nicely positioned, but I'm also hearing through the last year and a half of COVID, we've gone more virtual. We have different ways in which we have touch base with seniors, and that there could be more networks or stakeholders that could help get that survey into the hands of those seniors that we're connected to because of how we're currently operating. And so if you want to take a look at that, I think the City of Aurelia has it open until end of June. Again, they're kind of doing the work, I think, around the initial plan, but there's some nice framing of the questions there that's very easy to maybe look at an example to adapt, adopt where appropriate. But it talks a bit about the 8 features of a community, or we just leave it open-ended to say, what most resonates with you about what you want to stay the same, or what you want to see changes to, or how access has or hasn't worked for you on things of importance, and just see what people come out with. But basically I thought, well, if we do a survey, it'd be nice to actually be pulling information from seniors and using networks we currently have and see what the themes are.
Right.
Anne Marie,
I think it would be good to know the demographics of seniors, the actual demographics, because what I'm concerned about is with surveys, there's always a small percentage of people that respond and the majority don't. And I guess my concern would be, how do we encourage the majority to respond to a survey? If you want to get a real good input, you need a good group of people to be able to do that. So I don't disagree with what you're saying. I think we need to know how we're going to get the majority of people to be able to respond. Molly?
I think we have a classic example with COVID vaccines. There are a great many of this community that are not vaccinated and never will be. It doesn't make sense to me, and there's the same with every survey we do. A lot of it doesn't make sense.
Mm-hmm. Well, it depends on who does the survey and how it's done, but I think as part of our mandate, that might be something we really want to take a look at. Because if we're going to go out there and get information from people or get feedback, we're going to have to use what Anne Maria said. We're going to have to use different vehicles, and surveys would be one way to do that. Gwen?
Maybe Berry Families Unite would be helpful in that, because, well, they don't just look after seniors, they look after everybody. But in every family, there usually is a senior.
Mhm.
And they are, hands on the ground. And I really don't think through media, you're going to really reach everybody a lot of people that are seniors. Many people, especially ones with less money, don't even have a computer. And then maybe they only use it for Facebook or emails. I don't know. But I think another thing I think we really need to attack is ageism. I was doing a PowerPoint for my presentation for the library for this senior month. And I went through hundreds of photos looking for something to insert. Not one senior. There wasn't a senior amongst all those photos. I guess we just don't exist.
Mhm.
So I think ageism is one thing that we could look at going forward also.
Yeah, and that was one of the things I did have on the list, because if you look at the World Health Organization's statistics on the different groups of discrimination, ageism is higher than racism. Ageism is the #1 form of discrimination, even disability in the world. So I think, yes, I agree with you. Okay, I think we've got a lot of things to.
Oh, sorry, Donna, if I could
Yeah.
just ask one thing of Anne Marie.
Sure.
Is Lucia, Anne Marie, is it Aurelia or is it Penetangwishing? Because I was contacted by Penetangwishing that they were looking at their age-friendly plan, but
Yeah,
I
there's
don't
lots of
know.
there's lots of movement right now. Aurelia's open, and they're doing some creative work, and I think they got a grant, or they're hiring a coordinator too. So it would be good to kind of maybe take a look at both. But the one I saw,
Yeah.
Lucia, was posted on the City of Aurelia site. The survey's open to end of June, and you can go in advance and take a look at some of the questions. They're pretty good.
Yeah, because Penetangwishing has the survey out now as well.
Yeah, and we could go to, oh, sorry, I cut you off there.
Yeah, no, sorry, go ahead.
We could go to both and ask about how they're leveraging different networks. So, and
Mhm.
not getting down too much in the weeds around tactics, but if we choose to do a survey, and I remember Molly sitting with you and having a one-on-one around how we help to get out the survey to seniors through the health system. And so I think there's a multi-pronged approach, but we could actually find out what Aurelia is doing, what Penetangwishing is doing to get the word out, and what worked well for them.
And I wonder too, on the other hand, if we could support them having, gone through it already ourselves. And I think my last point of reference is that the last time we really had formed a relationship with the community was when we did ask for community input when we were forming the age-friendly plan. And I think that started the engagement with seniors, and then it just kind of petered off from there. Just an observation.
Yeah, I think part of it was too, the committee that was set up during the development of the age-friendly plan for Barrie was a very large committee consisting of a lot of organizations. And with our committee here, we're limited to the numbers of individuals as part of the committee. And I know one of the things that Cheryl had mentioned is if there was going to be an update to the age-friendly plan, because we'd asked the question, that committee would have to be struck again in order to do that. But Barrie has decided to stay with the plan that they have and just move forward on that existing plan. And they're not looking at redoing the plan or updating it. That's what Cheryl has indicated to us.
Yeah, I'm wondering if part of that survey could be, of these things that we've addressed through the age-friendly plan, what do you care most about? And having residents maybe actually help to inform our discussion if we're relooking at our mandate, and then the work plan for the next committee is there any information we can provide forward to that next committee to say these are the top 3 areas of focus that we heard from seniors about what they care most about. And I'm not sure, Molly, if you've got your hand up there, if you had a question.
Molly, go ahead, Molly.
Yes, I have. COVID has stopped a lot of opportunities that we used to use. In fact, it seems to me we had a banner made so that we would be easily identified when we did attend these meetings and have tables and explain who we were and what seniors needed and what they would tell us. We used to do a lot of interaction then. COVID stopped all that. But I thought that was a very good source of information. I hope it resumes.
Yeah. I had one last piece, Donna, that I wanted to add, and it was more in association with the conversation that you and Gwen had raised about ageism. So I'll make a note of it in case it wraps up into any future conversation. But there's some really fantastic research coming out of Dr. Gord Fleet out of York University on belonging. And part of some of his work does look at, I think, even a piece about even post-retirement. So the wellness from a sense of, post-retirement, what is one's connection to community? What is one's sense of belonging? And how does that impact later life and how they are engaged and or their sense of wellness and how it contributes to health. So that's also an interesting piece when you mentioned ageism, where it's also around other pieces from a psychological aspect that influence wellness.
Yeah. You make some good points, but I do agree with Gwen. I've noticed that too. Even anywhere you go, everything is to promote the young people because they're the new, they assume they're the new buying power, but actually the seniors have more buying power than a lot of. But this is another interesting statistic is this is the richest generation, and the money, the available dollars for people to spend is the biggest in this generation. So that's interesting as well. Does anybody else have any other comments on the issues we've talked about at our meeting? Or want to make a comment? Gwen?
I just wanted to ask Anne Marie, do you know if there are any seniors that are among the homeless in Barrie?
I can mention, I think there was a numeration report that came out. I can circulate that. So it did actually identify demographics, and I think we also understand it to probably be underrepresentative of what we're seeing to some degree. So I actually got a link to a forum that happened through Simcoe County, and I can circulate that.
Yeah, I looked at that report, Gwen. The numbers are very small.
Good.
Very, very small. Well, in the report that I looked at, the numbers of homeless in Barrie were very, very small for seniors. And I know I'll look and see if I still have the report. I'll send it to you. But that surprised me. There was very few. Molly?
I think one of the effects has been with so many of the next generation to mine losing their jobs through COVID, that they might have been helping seniors support themselves.
Mm-hmm.
And that's been taken away. And I also don't know that many seniors would want to admit that they were homeless.
No.
We're a very proud bunch, you know.
I've got those documents at hand, so I can forward them to Brandy if you want that to go in a package to the whole committee.
Sure.
With some other links.
Yep, that would be great. Thank you. Yep. Any other comments?
Well, I was just thinking because we're the third highest rent in Canada for like a 1-bedroom apartment, I think there are going to be more homeless amongst us.
Oh, yes.
I mean, the poverty of Canada, and I verified this a month ago, the poverty line is 19,500 or 1,625 a month. Well, a 1-bedroom apartment in Barrie eats up just about all of that.
Mm-hmm. No, you're right.
And that is the monthly income.
Yes, that's for the full month.
Yeah, you're right. Okay. We can take a look at those statistics, and if that's something you want added to an agenda item, then by all means put it on. Yep. Any other comments? No? Okay, so I think as a committee, we have a good plan going forward and a lot of things to look at. So we'll get this information out to you. We won't meet in July, but we will meet in August. And we will meet in December. And by all means, prioritize what items you want to look at first, and we'll move forward with that, and hopefully start the new year with a lot of good information and a good plan. Okay? So everybody have a great July. It's going to be a hot one. And we'll look forward to seeing you all in August, okay?
Jessica, sorry.
Jessica had to jump off. She did
Oh, okay.
have another meeting. So that was actually very recently.
Okay.
So
Okay, great. Okay, thank you very much for coming. And I'm
Could you
sure we'll-
confirm the dates that was on the agenda? Could you
Yeah,
confirm the
well,
dates? of
I'll
our
have
meetings?
Brandy send you out the dates for August to December, and we'll look at the second week of December as our meeting date. And she's got to see and make sure that there's available resources for that meeting.
yeah, I need to
Brandy-
make sure that December doesn't conflict with any other meetings or anything like
But
that.
if we're looking, Brandy, if we're looking at August, our August meeting should be,
The
Regularly.
23rd, I think.
I would think so, around that, yeah.
so
Monday the
just so
23rd.
everybody knows, and so the fourth is 1, 2, 3, 4, 23rd of
23rd,
August
yeah.
should be our next meeting, okay?
Yeah.
And then we will
Brandy
get
has
you a
my-
list.
Brandy
Thank you,
has my
Donna.
con- Thank.
Yes,
Sorry,
thanks.
Molly.
Have a
has
great
my
meeting.
con- Brandy has my commiserations for joining this committee. I bet she never thought it was going to be like this.
Well, I'm doing a bow. Thank you.
Your training ground.
All right,
Thank you,
thank you,
Donna.
everybody.
Thank you,
See you
Dawn.
in
Have a good
August.
summer,
Okay.
everybody.
Yes, happy
Thank
summer.
you.
Keep
We'll
well,
be in
everyone.
touch.
Thank you, Brandy. Okay.
Thank you.
Thank you.